Well, hi, welcome everyone to this NCCMT webinar, Focus on Students, Resources to Prepare You for Your Public Health Career. My name is Susan Snelling. It's a pleasure to be with you today. We'll just take another probably 30 seconds because people are just joining the webinar now, and then we will get right to it. Okay, I think we can get started now. Hi, everyone. It's Susan Snelling here from the National Collaborating Center for Methods and Tools. I have some panelists with me who I will introduce in a moment. It's great to be with you today for this webinar titled Focus on Students, Resources to Prepare You for Your Public Health Career. If we go to the next slide, please, just a little bit of housekeeping to keep us all organized here. If you've got any technical issues, you can message Alana Miller, who's helping us on the technical side today. So just use the chat for that purpose. We do have live transcripts enabled. You can use the Q&A or the chat to post questions and comments throughout the webinar. I think you're probably pretty used to doing this by now. And we will have some polling questions today in the webinar. And when they open, they'll just pop up over the slide. There might be a little slight delay. Don't be surprised by that, but that's part of how we'll just collect a little bit of feedback from you. I see, Ashley, you have your hand raised, and I don't know if there's a question or a technical issue. I'm not sure if we can Q&A. Let me just see. Okay, Ashley, I hope everything's good. If not, send a message through the chat and we'll get you sorted. Okay. So after today, the webinar recording will be available in English at our YouTube channel, which is YouTube and then NCCMT. You can search for that. And the slides will be available in English and French at our SlideShare account. And you see the address there. So first of all, a little introduction to the National Collaborating Center for Methods and Tools and the NCCs. Then we'll talk about evidence-informed decision-making and then get right to the student perspectives on evidence-informed practice. We will have time for questions and discussion. So I'll pause from time to time to see if we do have questions. Excuse me. And, you know, we hope to have a fairly informal time of it and do some discussion and back and forth as well, just as we're going. In terms of our learning objectives, we're hoping that you will become familiar with the features of a model for evidence-informed decision-making and that process for evidence-informed public health, that you'll know about some tools and resources to support you in public health practice to find and use the best available research evidence in decision-making. And that you'll get some insight into the perspectives of current and recent grads in terms of how they have used methods and tools and what evidence-informed practice looks like in sort of real life in the work that they are doing. So We will bring up a poll now, and this just gives us an opportunity to get a little bit of background on who's with us today. So we'll just take a moment to ask you to answer these questions. There are 3 questions, so you may have to scroll to get to them all. Our first question is a little bit of a holdover from pre-COVID times when people used to like actually come together in groups and do things in classrooms and so on. Maybe some of you are there, but probably as I'm seeing the results of this, most of you are participating in today's session just solo. But you're part of a group here. You're part of evidence people, and we're happy to be with you today. So I think we've probably got most of those responses in. So Alana, do you want to just give a quick look at how people are responding? Most people are watching the session solo, but we do have some in larger groups. That's probably a classroom, and if that is, welcome to all of you. So some of you are familiar with the National Collaborating Center for Methods and Tools, which is at nccmt.ca, some of you not, but we'll change that because we'll tell you a little bit about NCCMT. And of those who have used our resources, some of you have been there a couple of times. So that's great. Something for everyone here, I think. And we look forward to talking with you about NCCMT. So I'll just talk a little bit about the National Collaborating Center for Methods and Tools. We are one of 6 national collaborating centers in Canada. We're hosted at McMaster University in Hamilton. And our goal is to support public health professionals and organizations integrate evidence-informed decision-making into our work in public health. So national collaborating centers, all 6 of them, are funded by the Public Health Agency of Canada. We each focus on a different priority public health topic. From the West, there's the National Collaborating Center for Indigenous Health in Prince George, BC, the National Collaborating Center for Environmental Health in Vancouver, the NCC for Infectious Disease in Winnipeg, the NCC for Healthy Public Policy in Montreal, and the National Collaborating Center for Determinants of Health in Antigonish, Nova Scotia. So I've talked a little bit about evidence-informed public health, but let me say just a little bit more about what I mean when I'm talking about that. Sort of a longer definition is that it's the process of distilling and disseminating the best available evidence from research and context and experience, and using that evidence to inform and improve public health practice and policy. We can also say that evidence-informed public health means finding, using, and sharing what works in public health. Now we have a model that we use at NCCMT. We call it the wheel. This is stages in the process of evidence-informed public health. And if you're interested in knowing more about these stages and methods and tools to support their use, you can find lots of information and resources on our website at nccmt.ca. But just to briefly comment on what we're seeing when we look at this model, These are stages in evidence-informed public health where we usually start at the top with defining a question. So if you're looking for evidence about something, you need to narrow down that question and figure out exactly what it is that you want to know from the research evidence or from other forms of evidence. Then going around the circle, you need to have some knowledge about how to search and where to search for that evidence. Then appraising the quality of that evidence, garbage in, garbage out. So you want the best quality or the best available evidence to guide your decisions. Once you found all of that relevant evidence, you need to synthesize that, and there are methods and tools and skills to be able to bring all of that together and present a coherent answer to the question that you defined. And then when it comes time to actually applying some of that evidence, we need to adapt that to our local context, local community. Public health is very much defined by local context. And so when we're working in public health, we're not working in isolation. We have to take into account what's already going on in our communities and adapt our interventions to suit the populations that we serve. Then we actually get to implementation, and implementation is not just a snap your fingers and it's done. There's a whole process to actually implementing an evidence-informed practice or policy. And then, of course, we want to know if it worked. So there's that evaluation step that often then leads us into asking more questions. And so the wheel can continue. So as I said, lots more about this approach to evidence-informed public health. It really is the guiding principle for much of what we do at NCCMT, and there's lots of depth that you can find if you do check this out on our website. And then there's another model that I'll just comment on briefly, and this looks at different ways that we may understand evidence. So as we're talking about evidence-informed public health and ways to find and use that evidence, well, what do we really mean by evidence? Certainly there's research evidence, so that's in the bottom left bubble. And you know, we certainly focus a lot on methods and tools to help people find and use the best quality research evidence. But when we go to make a decision in public health, it's not only about those published articles in journals that are going to tell us what's the best decision to make or what's the most relevant evidence. We also need to look at community health issues and local context. So what's the burden of a certain disease in our community? How important is this issue? What's one disease priority relative to another? And those things can be different community to community. And so we need to take that into account in order to make the right or the best possible decision. We also need to look at community and political preferences. What's already happening in our community? Maybe we don't need to do anything because someone else is doing it. Or maybe our community has a strong interest and would really be supportive of a certain action. And in other cases, it's just going to be a no-go. So you need to adapt and adjust to the community that you're in so that the interventions you're offering or considering are those that really suit your community. And then public health resources, that's money, that's time, that's people and skill sets. You can have the best intervention in the world, and if you don't have the people to deliver that intervention, it's not going to be the right intervention for you at this very time. And then all of that comes together with our knowledge, our understanding, our public health expertise, all of this pulled together to help us make the best decisions possible to guide our public health practice. So with that, I'm going to move to the main focus of our conversation today, and that is to hear from recent graduates about a couple of questions. So we asked these two questions. How are evidence-informed decision-making skills important in your studies or in your work in the public health field? And what's an evidence-informed decision-making resource you have found useful? So it is my great pleasure to introduce our presenters today, and I'll have them introduce themselves to you and just tell you a little bit about their backgrounds, what they're doing now. And then once we've heard from them, we'll get into answering those questions that we posed to them. So first of all, Alyssa, would you like to introduce yourself?
Sure. Thank you, Susan. Good afternoon, everybody. My name is Alyssa Kostopoulos. To give you a bit of background about myself, I did my undergrad at McMaster University in life sciences, and then also did my master of public health at McMaster as well. Otherwise, I've worked at the local public health level in various positions while I was a student. I was a summer student for a few years doing beach water sampling as part of the health protection program at a local public health unit. And then also for my practicum placements was an epidemiologist student at the same local public health unit as part of the COVID response. And I mainly worked in reporting and planning or prioritization of the vaccine rollout, which was a really interesting experience. And then now I am a research assistant at the NCCMT since January, and I work on a number of different projects, mainly our rapid evidence service, which you'll hear a little bit more about later in the presentation, as well as some evaluation projects and communications.
Thank you, Alyssa. Fantastic. Next up is Sophie. Please introduce yourself.
Hi there, I'm Sophie. So a bit of background. I did my undergrad and grad school at the University of Guelph. Undergrad in biomedical sciences and grad school in public health, and I graduated last spring. So between then and now, I've worked at the National Collaborating Center for Methods and Tools as a research assistant for the last year. Before that, I was working in various public health and One Health organizations, including the Wellington Guelph Drug Strategy, as well as Community Veterinary Outreach. And those are both kind of interdisciplinary public health organizations focused primarily on public health programming for vulnerable populations, often populations either who are experiencing homelessness, and with the Wellington Guelph Drug Strategy, people who use substances. So public health programming kind of at the front lines and a little bit at the program design level. And currently, similar to Alyssa, working with a lot of evidence-informed decision-making daily, as well as appraisal of evidence.
Great, thank you, Sophie. And then finally to Carleen.
Good afternoon, everyone. My name is Carleen, and I work as a knowledge translation specialist here at NCCMT. A little bit of my background, since it's a bit different. I did my undergraduate degree at the University of Ottawa, and I did it in psychology with a minor in biology. And then from there, I went to York University, and I did my Master's of Arts in Psychology with a neuroscience diploma, both of those being in the research stream. After that, I decided to kind of take a turn into mental health, so where I was more patient-facing and actually the one that's applying interventions. And after that, I decided to do some volunteer work for an international consortium where I did more KT work, such as appraising quality, appraising studies for their quality. And that kind of helped me fall in love with KT, and here I am today.
Great. Okay. Well, so we're really fortunate to have these three presenters today who bring, really different backgrounds and different experience, but all working in public health in some unique ways that we'll hear about. So as I said, we asked each of Alyssa, Sophie, and Carleen to respond to this question. First of all, just reflect a little bit on how evidence-informed decision-making skills have been important, either in the studies that you've completed or in the work that you have done or are doing now. So just kind of give that commentary on why do we care about evidence-informed decision-making skills anyway, and how have those shown up for you? So again, I'll go to Alyssa first, just for some comments about that.
Thanks, Susan. Yeah, so thinking about this question and the importance of evidence-informed decision-making, I reflected back on first my education, and I feel like during your university education, you start to learn more about research and evidence, and you learn that unfortunately there's a lot of poor quality evidence in the literature. And thinking about in school, especially kind of before my MPH and earlier on, let's say when I was doing an assignment, it's really easy to take the approach of looking for evidence to build your case for what you're trying to communicate in an assignment, or almost cherry picking of what's out there, and not really considering the quality of that evidence. Especially as a student, you're kind of on time limits, you have lots of assignments, and that's totally understandable. But now that I've kind of been on the other side and been working in a public health career, where there's another perspective there, where you're ultimately serving the populations around you to deliver interventions to improve their health. And whether you're working in at a local public health level and serving smaller communities, or you're working at a larger regional or national level and serving bigger populations, that still stands. And it really just puts things into perspective, where our decisions in what we decide to implement as public health interventions have consequences for actual people in our communities, and there's a greater social responsibility associated with that. So it's important to use that critical lens to understand what's the best thing we can do based on the best available evidence and the specific context of the population that we're working with. So you kind of have that responsibility to your organization and yourself in your career, but also to the community that you're serving, and that these interventions are going to impact, and including the taxpayer dollars that they're coming from. It's their own tax-paying dollars. So there's a number of kind of sides you can look at it from, but basically just a greater social responsibility.
Mm-hmm. Yeah, it's an interesting perspective that you bring, Alyssa, that, you know, as we start to think about not just sort of making a case in a paper, but actually, you know, seeing that our decisions have consequences, you know, very immediately for decisions that are going to affect people's health. You know, you maybe start to look at the role of evidence in a somewhat different way. Sophie Newman, what about your thoughts about why EIDM skills are important in either in your studies or in the work that you have done or are doing now?
Thanks, Susan, and thank you, Alyssa, for that. Just building on a little bit of what you said, Alyssa, I think I think as we all, you know, have experienced and know, there's a lot of information out there. An infodemic, I think most people call it now, where you can essentially, as Alyssa was saying, find any information to back up your case. And I think the role that evidence-informed decision-making plays is that not all evidence is created equal, and also to be very intentional about how evidence is used. So a lot of public health in general is applying evidence and applying the knowledge that we have based on the evidence to improve health at a larger scale. And so it's really important to make sure that the evidence we are using or relying upon is of high quality or of high certainty. So, you know, whether we're looking at different sources of evidence, as mentioned earlier, so not just peer-reviewed literature, you know, there's publication bias, there's a whole Western research paradigm that we're used to operating within, but there's other sources of evidence, including community evidence and individual experts kind of weighing in on certain issues. And that's really important to keep in mind, and is as sometimes as equally as important, because we may have like an RCT that shows really good clinical statistical evidence, but that might not be applicable for the audience. So there's a lot to keep in mind. And I think being able to use tools to support evidence-informed decision-making can help sift through that infodemic and really pick out what is useful and what will actually help in the application of that knowledge.
Yeah, thanks, Sophie. Great point. Not all evidence is created equal. And so, you know, part of the skill set is to be able to pull that apart and say, well, you know, which evidence is more reliable, high quality, higher certainty. So that's definitely a skill set to be, you know, to be building and relying on. And then Carleen Stobie, what about your thoughts?
Thanks, Susan. Yeah, so I kind of take my lens a little bit for research, where a lot of times past evidence is used to sort of develop future research questions. And a lot of times, rather than looking, and I can speak personally, rather than looking at the quality of the study using different quality appraisal tools, we'll look at studies based on what journal they're in or what authors conducted them or the impact factor. And then from there, future research questions are based on this. So sometimes this can lead to research waste, because low quality studies then kind of promote low quality questions going forward, which promote low quality studies going forward. And this can lead to research waste. And a lot of times research questions aren't even based on past evidence at all. They're based on other factors. And again, this can sort of lead to research waste. Also working in mental health prior, I have also experienced sort of like the downside of, rather than using evidence-informed decisions, we kind of do like what has already always been done. And sort of how Alyssa mentioned, a lot of times this can be a hindrance to public health or patients, because rather than sort of basing decisions off of what has been shown to be high quality or what works, it's based on other factors that may not be as beneficial. So those are some things that are true, and the importance of making evidence-informed decision-making, both on the public health side, but also the importance of when research is being conducted to really know what EIDM is, so that you can apply that in research and we can have higher quality studies being produced right from the get-go. And so kind of applying that now in my present job, that's what the NCCMT is really all about, is showing the importance of evidence-informed decision-making for public health. And we do that using webinars like today, or the creation of guidance documents, or, you know, having our registry with tools that show this is what evidence-informed decision-making is, and this is why it's important. So that rather than, so that when people make decisions, it can be based off of things that are helpful going forward.
Yeah, thank you, Carleen. That's a great perspective too, is that, you know, as we think about evidence-informed decision-making and applying evidence to decisions in public health, well, that evidence has to come from somewhere. And so when we're thinking about research evidence, you know, the quality of the research, of course, is important, but also, you know, just having that understanding of what leads people to do research in one field and not do it in another, or do the study in a certain way and not in another. You know, that can create some gaps in our research knowledge that that could be done differently. So that's it's a great perspective to be thinking about. Thank you. Thanks to all of you. Now, the second question that we asked our presenters to reflect on is the resources that can be used to support evidence-informed decision-making. And you know, what resources, what methods and tools have you found useful? And that might be something that they have actually used in their studies or in their work, or maybe some things that they know about now, but would have been useful in their studies, even if they didn't know about it. So maybe, you know, they'll save you a little bit of pain or a little bit of time if they tell you about something now that you might be able to use in your studies. So we have some slides to sort of guide through the suggestions about those resources. And for the first set of resources that may be useful in evidence-informed decision-making, I'll ask Alyssa Kostopoulos to talk about these online learning modules.
Yes, so something that NCCMT offers that I actually was aware of during my MPH was the online learning modules. I had taken a knowledge translation class in my MPH, and it was actually taught by an NCCMT staff member, and they, as part of the course, we did these some of these modules, and that really helped support my introductory learning on EIDM and knowledge translation. And I think it's a really great starting place, whether or not it's a requirement of your course, even to supplement your course learnings throughout your graduate program or whatever you're doing, or even in your career. It's even a great refresher for a lot of these concepts. So there's courses, as you can see on the slide, an introduction to evidence-informed decision-making. And then there's a number of other courses, a lot of modules on critical appraisal. So I think it's just a really great starting place or refresher, and they're free. So they only take a couple hours each also. So I think they're a great resource to have.
Great, thank you, Alyssa. Next, we'll hear from Sophie to talk about the success pyramid.
Thank you. So this was not something I was aware about in my grad program, but I sure wish I was. So this pyramid, you may have seen it before. It kind of goes through it's kind of like a pyramid of levels of evidence. And at the bottom is kind of your lowest certainty of evidence, or evidence that you don't necessarily want to make super strong conclusions from. So those are single studies. And it kind of goes through the different levels of evidence: synopsis of studies, syntheses, synopses of syntheses, summaries, and then systems. And by the time you get up, if you find a system review on a particular topic, that is most likely a much higher certainty of evidence. So you're more able to make conclusions or recommendations based on that evidence, whereas a single study might provide you some statistical significance, or may indicate a certain intervention is successful, but it does not necessarily guarantee for all audiences, and it may not be enough to kind of change a policy on the subject. So it kind of goes into what constitutes each level, but more so it gives you some databases and some websites to find systems reviews or summaries or studies on a specific topic. So if you were to click any of these levels, so right now in this slide, it's on syntheses, it goes through the different, some different resources for you to find syntheses. So health evidence, I think we'll talk about in just a little bit, but that's one repository where you can find syntheses on various public health topics. So this is something that is a really good tool for understanding and applying those different levels of evidence. And certainly, I think I would have found it very helpful if I did have it or if I knew about it during my grad studies.
Great. Yeah, thank you. Lots to dig into, I think, with the success pyramid, not only just conceptually understanding those different levels and why we would say to start at the pyramid and work your way down only so far down as you need to, but also some of those options for where to search for that kind of evidence. So health evidence being one of those. Public Health Plus is listed there, the TRIP database. And some of those sources being pre-appraised, also good to know because it helps you to kind of navigate through where the highest quality evidence can be found. So great, thank you, Sophie, for sharing about that one. Next, I'll ask Carleen to talk about quality appraisal tools.
Yeah, thank you, Susan. So as I mentioned previously, it's not just is there a study on this particular topic, but also the quality of it, how well it was conducted, and evaluating its research methodology is very important to when we use it in different disciplines or if we want to make decisions based off of it. So if we go on our website, you can see that there's various tools you can use. So there's the AGREE tool, for example, which is for clinical practice guideline development, or there's a CASP tool, which I have some experience in my past with, which is a tool that you can use to appraise, but it's also divided into different study designs. So whether it's an RCT or something else, you can use the CASP tool for the different study designs. And this is really, really helpful because you want to know the quality of the study moving forward based on its research methodology, and therefore how much you can trust the results and how much you can trust the results if you want to make a decision based off of it. So these are good tools to help with that.
Yeah, thank you, Carleen. And this is, something I think that we've been talking about since we started the webinar today is, that sort of best available, the best quality. And so pretty quickly you come up against that question, well, how can we know what is the best quality? And these are some methods and tools that can really help you to appraise the quality of evidence. And as Carleen was saying, the CASP tools, among others, but the CASP, so that's CASP, do a pretty good job of describing what to look for. So, they kind of hold your hand a little bit and walk you through. And the CASP tools were actually created to teach people how to do critical appraisal or quality appraisal. So they are good tools, I think, to start with if you're not familiar with quality appraisal tools, because they do provide a fair bit of detail as to what we're looking for in the different domains of quality and how to tell whether something is good quality or not. So yeah, great resources to know about. Next, we'll go to Alyssa again, and we've mentioned health evidence before, but let's talk a little bit more about what health evidence can do for you.
Yeah, so health evidence is its own website, but it's basically a repository of pre-appraised synthesis level research and evidence. So I was not aware of this when I was in school, but I really wish I was. It's kind of combining some of those concepts that we mentioned before. So critical appraisal, this is pre-appraised for you and provides a quality rating. already. And then it's also all review level evidence, so synthesis level research. So it's kind of higher up on that success pyramid. And I would have found this really useful to search at the beginning of an assignment or a project, to kind of get the lay of the land, find out what evidence is out there and available when starting an assignment. And especially because as a student, you don't really have you don't feel like you have a lot of time to critically appraise your own evidence that you're using in one of your many assignments, right? So this kind of takes away some of that time and effort while maintaining that quality and the confidence that you can have in the evidence that you're using.
Yeah, thanks, Alyssa. Yeah, health evidence is a great one, I think, to have in your back pocket, just, you know, regardless of what you're doing. If it's something related to public health and you're just saying, oh, what do we know about this? You know, get grounded in it. Looking at syntheses is a great way to get that overview, and health evidence is regularly updated. And so, you know, we're constantly bringing in those new systematic reviews and meta-analyses. So, you know, you'll find things that are entirely up to date, and having them pre-appraised gives you a sense of the quality there. So this is, I think, a great resource. Next, Sophie will talk about one of the tools that's attached to health evidence, which is the briefing note tool.
Yeah, so in addition to being able to search for the quality appraised studies syntheses that Alyssa mentioned, there's also a few different tools on health evidence, and one of which is the briefing note. And I did know about this in my undergrad, or not undergrad, my grad school, and use this primarily in my public health policy class, which some of you may be taking as part of your programs. And this is a tool to help you organize evidence with the aim of being able to make a decision. And as a student, that was a hypothetical decision, but definitely is something that is very common. These briefing notes are very common within health policy or public health policy. So it's similar to what Susan mentioned earlier when she was going through the kind of public health expertise Venn diagram. It goes through different types of evidence. So you have research evidence, as we've mentioned, which obviously is very important to decision making, but then it also goes through kind of the social political context. So would this evidence or would this decision work for the community or the area, and why might that work? What evidence would lead it to work in this context, as well as colloquial evidence. So what kind of evidence, what kind of similar programming has been employed perhaps in other provinces or other countries? How did this work out? And would it be as effective, or would it be similarly effective as a decision or a program to be employed in whatever context that you're preparing this briefing note for? So it goes through the steps of how to put this together and the different kinds of evidence and where you might find it, and then it leads you to being able to kind of synthesize that evidence into a decision making and a final decision, or a couple final options for decision. So this is really helpful, kind of the next step after you've collected all your evidence. How can you distill that into something that is useful for public health programming or policy decisions?
Yeah, thanks, Sophie. This, you know, I do a lot of training of people who work in public health, you know, in all fields. And one of the questions that we get all of the time, and there's no real simple answer to it, is, okay, I've, kind of made my way around the wheel. I've defined my question. I found some evidence, and, I've got it appraised now, so I know which is the best quality, but how do I put all of that together? And how do I come up with, the right answer? And, spoiler alert, there's no right answer, but there's probably a better answer, better decision than other answers. How do I pull all of that together to really guide me to the best possible decision? Well, yeah, it's not easy because, some reviews or some studies will be saying one thing, others will have a different answer, or, there will be a little bit of nuance there, it works here, but not there. And then we've got a different context in our community than the kind of communities where the research was done. So it can get pretty complicated pretty quickly, and it's easy to become overwhelmed with, that sense that we need to make a decision, but we've got lots of pieces of input. And that's just the research evidence. Then you start to bring in those other things that we, know about our communities, expert opinion about, what we've sort of seen working, what we've tried that hasn't worked, what's going on politically in your community right now. Like, all of these inputs need to come into play. Having a tool like this doesn't give you the answer, but at least gives you that structure to organize what you've found. And particularly if your role is to pull together the evidence for someone else to actually use in making a decision, the better you can organize what you've found and kind of lay out the different inputs and the different perspectives, the easier it gets for the person who's actually using that to make the decision. So using a tool like this to guide you to an organized way of bringing together all of your findings, and then helping you to determine a little bit, how do I weight this? Which of the pieces of evidence is maybe more trustworthy than others or more relevant than others? This is the kind of question that we need to ask ourselves when we're facing that, large pool of evidence. So it's one thing to make your way through one review or one study, but when you've got lots of them, a tool like this can really be helpful. So thanks for talking about that one. Next, we'll go to Carleen to talk about these understanding research evidence videos.
Yeah, so these are videos that I didn't know about in my degree as well, but from which has been mentioned, I wish I did. They're basically short videos that show snapshots of important concepts in public health or statistical concepts to really help build a solid foundation. So there's a video on clinical significance, for example, or confidence intervals. And they're basically less than 10 minutes that offer sort of a easy to consume, manageable, entertaining way to really understand that concept at hand. And it's great because rather than ciphering through Google of like, okay, what is confidence intervals? And there's all these different websites and some of them might be hard to understand. You have a really easy to understand quick video that explains it to you in a manageable way. So.
Yeah, thanks, Carleen. And these are videos that NCCMT created in part because as we were doing training for people who work in public health to build their confidence in reading research evidence, people would come up against these challenges a lot of, well, my stats course was like many years ago, or I never really quite got that concept. And I'm working in sort of a different field where I don't have to use these concepts all the time. Now you're telling me to go back into these research studies and actually take responsibility for understanding what's in them and appraising the quality of them. And it seems like a lot. So, to be able to say to people who are working front line in public health, yes, you can read this research article, and when you come up with something like what is a p-value or what is a confidence interval, and you're like, what was that again? Or, it seems like I, can't quite navigate my way through this. To have something that you can go to in like 5 minutes, kind of get your answer, get the concept, and see it presented in the context of a public health example, really helps people to build their confidence in reading research evidence so that they can, get what they need to get out of that research evidence and then apply that to public health practice. That's really what these videos are dedicated toward, is just helping people to, be able to own the reading of research evidence, not just leaving that to someone else, but being able to navigate it themselves. So these are great to know about. Now, the next resource that Alyssa is going to talk about is the Rapid Review Guidebook. And I think we've mentioned a little bit that, I think all of the people on this call, including myself, as presenters, have been doing a fair bit of work in the rapid review domain, certainly since COVID, if not before. So Alyssa, please tell us a little bit more about the Rapid Review Guidebook.
Yes, so the Rapid Review Guidebook basically is a guide that goes through the steps needed to conduct a rapid review, and specifically the steps that our team at NCCMT have kind of taken throughout the pandemic as we've been conducting rapid reviews, which has been very much needed during COVID, when there was all sorts of evidence coming out at a very quick pace, and the evidence landscape was changing very often. So basically takes that systematic approach to reviewing evidence at a synthesis level, but in a shorter time frame. So this is really useful if you would like to learn about what an evidence-informed rapid review process looks like, or a guide to follow if you would like to conduct a rapid review yourself.
Yeah, thank you, Alyssa. This is, really is sort of that step-by-step process of doing a rapid review. And it, as implied by the name, because it's rapid, you have to make some choices about, where you're going to limit your review, because some systematic reviews, I mean, people, and there are probably some people in the audience right now who have worked on these, and you work on them for 2 years. Well, in a time, like a pandemic, you don't have 2 years to sort of, wait and find everything about it. So you want to be moving rapidly, but still have some integrity to the process, still have some quality, still have a systematic approach to, what you search for and how you do that search, and, what gets included and so on. So the Rapid Review Guidebook gives you those steps to follow that still make you feel like you're doing a good review, even though you're doing it in a compressed time frame. And that's what evidence-informed decision-making really is about, because it's applied. You don't have endless time. You have to make some of those calls about, okay, this is going to be good enough. We're using the best available, and that is good enough for making decisions as we need to do in public health, and then move on and actually start doing stuff. It's not just about reading research, but it's about, finding the best available evidence and then applying that to public health interventions. So the Rapid Review Guidebook is very much centered on that need to find and understand the research evidence and pull it together, but kind of like get on with it too, so that you are, in a position to use that evidence to make a decision that needs to be made, sometimes in a very timely fashion. So the next piece, and we'll get Sophie and then Carleen to both talk about these, because it's been a piece of work that we've been doing quite a lot of in the past couple of years, and that is our NCCMT rapid reviews. So Sophie, do you want to jump in first on this one?
Definitely. As Alyssa mentioned, so the guidebook is kind of the methodology that we use to conduct these rapid reviews. So this repository is all the reviews that the NCCMT has completed. And some of these are questions that are coming to us from outside organizations who are involved in public health decision-making. Whereas some of them are ones that are very relevant to public health that we also complete. Quite a lot of them have been on COVID-19 due to the nature of what is public health relevant over the last few years. But we do have a growing number that are related to public health outside of the context of COVID-19. So in these reviews, as mentioned, we conduct a very methodological review, although it is compressed. So we go through the process as a team of conducting a search, doing screening, extracting data. We do, depending on the type of review, do quality appraisals of the included studies, and then summarize evidence. And also, depending again on the type of study, appraise the certainty of evidence. So the quality of evidence being a little bit more based purely on the methodology of the reviews or the studies that are included in these reviews. And then the certainty of evidence are based on several factors, but it kind of gives an idea of how certain are we that the results found in the study can be applied to a broader context. So in your programs now, or as you are moving forward into public health settings, these can be really helpful as a starting point to understanding the evidence that's available on a specific topic, especially if you are interested in COVID-related topics. And I'll pass it on to Carleen if she wants to add anything to that.
Thanks, Sophie. I think you really hit the nail on the head there, really describing the benefit of our RES page. I mean, it kind of, like you said, started off from the need during COVID for people in public health to really receive quick bites of information of what's going on. For example, we have a living review with schools and daycares and how transmission affects this sort of population or the sector of public health. And from there, it's kind of branched off so we can see now like strategies to actually implement like evidence-informed decision-making. So it's really kind of taken over into different public health sectors, but it's really a great source if you want like clear, concise reports that have good evidence there to inform you on that particular topic.
Yeah, thanks, Carleen and Sophie, for talking about those. And I would encourage everyone on the call to, to take a little cruise through the list of published reviews that are on our website at the Rapid Evidence Service, because it's, living through a pandemic is, something that's new for most of us, I think, certainly something of this scale. And so what you'll see in looking at these rapid evidence reviews, which, many of them were about COVID-19, although certainly branching out to other topics. As you look at the reviews that were conducted about COVID-19, you can sort of almost track the progression of our knowledge about the pandemic. I mean, if you think back 2.5 years ago, we didn't know very much about COVID-19. And so the research was really trying to grapple with these questions of like, how is it transmitted? So, there was an early review, for example, about fomites, which is, can it be passed on surfaces? And the thinking about that really has guided a lot of the methods that we put in place, the mitigation strategies that we've put in place for COVID, sanitizing everything, having, plexiglass put up at cash registers and so on, because the thinking was that, maybe transmission through surfaces was going to be an important piece of our knowledge about COVID-19. And then, you'll see sort of over time as the topics changed and, we needed to know more about different things. Our collective understanding of COVID-19 shifts. And this, to me, is a fascinating example of how evidence doesn't answer all the questions, but it can answer the question to the best of your ability at a given time. And so having those reviews that are rapid, timely, pulling together what we know, even if it's not perfect, even if it's not the highest of quality evidence, but when you're dealing with COVID-19, you sort of pull together what you know. And then the other thing that you'll see there is that for many of the reviews, we've done multiple versions of them. So we'll put out one and then we'll do an update in a few months or somewhere down the road, because there's a body of evidence that has come forward since that review was put out that maybe would change our perspective. And that's the nature of research, especially in a very actively evolving climate like the pandemic, that our knowledge base will actually change. And what seemed to be the best available answer at one time can be built on, and we can learn other things. So even looking at the progress of one review through the updates can be quite an interesting perspective into how evidence kind of lives in real time and can influence our decisions made at those times. So with that quick trip through some resources and some reviews that, or some methods and tools that may be of interest, I do want to turn now to questions and discussions. We have some time for this. And so we'll, if you have questions or comments, maybe there are other tools that you have used that you think are great and other people should know about them, please, now's your time to share with others. So we'll just look in the chat and see if there are questions, and please feel free to add other questions in the chat. So we do have a question, and Carlene, Sophie, and Alyssa, if you have a comment that you'd like to add, just please jump in. The question is, how successful do we feel that your recommendations are being used by practitioners and policymakers, and what were the barriers? So really at that kind of like end point of bringing evidence to bear on actual decisions. What helps those recommendations to be used, and what are the barriers? What can get in the way? I don't know whether any of you would like to comment on that question.
A couple things come to mind for me there. I think one of, I don't know if it's so much a barrier as just an innate part of the process, but sometimes we go through this process where we go through all the steps, the searching, the screening, quality appraisals, certainty of evidence, and we see that sometimes there is not a very high certainty of evidence, meaning that even with the studies that we found, the evidence may not be strong enough or applicable enough to make a particular recommendation. And I think that can be a little bit disappointing, and then have potentially less of a chance of making it to the decision-making level, just because the research isn't there. And then on the flip side, that informs that we do need more research on that subject. And then I think another barrier goes back to what we were talking about earlier, where although this research evidence, as well as we do gray literature searching, so that can be anything from potentially newspaper articles, commentaries, different programming that's happening at the public health level. Although we do collect all this evidence and may present a summary of what is effective, there may be other community contexts or political contexts that prevent or make it difficult to employ that decision making or that intervention in real time and in a really applicable way. So I would say that is a couple barriers or roadblocks that come to mind.
Yeah, completely agree. Carlene or Alyssa, anything to add?
Just building on what Sophie was just mentioning, kind of relating to the local context and other factors. Something else that comes to mind is even like, as much as probably people anywhere in public health would or are aware of the importance of using evidence-informed decision making and all of that, I think especially we've seen in COVID the limitations to resources, and that includes human resources and funding and all sorts of and time to invest in all of these steps that are important to take. So I think sometimes in public health, it's often that what's already being done is it's hard to, it takes a lot of effort, to implement new processes and changes at a larger scale. So it takes a lot to, for example, fully change a program or implement an entirely new initiative for an intervention. So I think that's another thing that, again, we've especially, that it's the case at all times, but especially during COVID when there was extremely resource limited settings in public health.
Mm-hmm. Yeah, that sort of gap between, okay, there's a sense that the research is pointing us in one direction, or maybe all the evidence taken together points us in one direction, but we've been doing this all along. There's a certain inertia, a lack of possibility of change in many areas, just like, like we're doing this, we're all set up to do it this way. And, to make that shift, it's a process. It's not something that happens overnight. And sometimes, you can bring the best available evidence and still people will say, well, it's got to be pretty good quality evidence for me to like shift everything and like change everybody's job and have people doing things in a different way. And that's really one of the examples of how evidence-informed decision-making is informed by evidence. But the evidence is not the only factor, and sometimes it does come down to those resources. Like we just don't have enough people to make this change and do this in a different way. So we're going to stick with what we're doing, which is maybe not terrible. It's just that, there might be another option that we should consider. But sometimes it's just not possible. Or, it's something that you need to work toward over time. I do find that people who start working in the area of evidence-informed decision-making kind of get very excited about that. And it's like, look, here's the evidence, and we should all be sort of following this and doing that right away. And the reality is that change is sometimes slow. There's sometimes resistance to that. And so part of the process of being a knowledge broker or, someone who's bringing forward evidence is to understand that there are human factors as well. It's not just the evidence kind of like speaking neutrally. People need to understand the evidence. They need to feel confident about the evidence. They need to feel confident that they could make that shift that's being talked about. And so, all of those things have to come together before you can actually implement a change. And it's not easy. It certainly takes time. We have another question here. Sophie mentioned sometimes finding that more research is needed in a certain area. And I think you spoke to this as well, Carleen, that, the research that you've been part of, sometimes it's there's sort of wasted research. So is there a mechanism to go back and make researchers aware of that knowledge gap? Great question, because we sort of have this sense of like, here's the research over here and it's kind of going along, and then, it maybe sometimes makes its way into the practice area. But, do we ever get sort of from the practice back to the research domain? Anybody want to comment on that? Maybe I'll go to you first, Carleen, because I think that's something that you've got a little bit of experience with.
Yeah, I think I did a seminar the other day, and they were saying that it takes about 17 years from research to actually be applied into intervention. And so I think a lot of times researchers do the research and they kind of just get it out there, and the knowledge translation is only really done in journals or a conference, but it falls short of being able to really be communicated to those who can apply the intervention, such as decision makers in public health, for example, or policymakers. So I think that there's definitely a gap with that. I think that's kind of where integrated knowledge translation comes into play. It's both sides working together, decision makers saying, this is what we need, or this is what's important for us, and then researchers being able to kind of take that. So it's working in collaboration, and that's a little bit our job as well, right? Being the bridge between both, being able to sort of understand research and communicate it to decision makers, but hopefully being able to go back as well, like taking the feedback of decision makers and what they're actually able to do based on capacity and resources, and then that can further guide research to make it more applicable or tangible, or being able to apply in reality specifically.
Yeah, great points. There's a way of talking about this that people say we want an evidence-based practice, but in order to have an evidence-based practice, you need practice-based evidence, so that the evidence that you have really is informed by what we're actually doing, in our case, in public health, so that it's not like it starts with the research and then we sort of pick that up at some point. But, what would it also be like if the questions and the approaches started in public health practice and that guided research? So there definitely are ways that people are trying to be much more connected in that way. And that really is going to be the key, I think, to having, still more evidence-informed practice in public health as well as in other fields. So another question about making evidence accessible to the general public so they understand where programming or policy is coming from. And again, I think living in and through a pandemic is one of those times where we see, policy being made quickly, often, and with inadequate evidence. Like sometimes we don't know or we just don't have enough, or, you know, the evidence is there, but it's kind of spotty and it's of poor quality. It's the best available, but it's still, you know, we just haven't had the time to really, you know, dig in. And it's not just COVID. There are lots of topics like that too, where we just don't see policy that is necessarily informed completely by evidence. So then the general public is saying, well, you know, why does this have to happen? My sense with this, you know, in terms of the general public, is that there's a balance between saying, you know, here's the evidence and therefore we're going to have this program or this policy, but also being honest about the gaps in our knowledge. Here are things that we don't know. Here are things that where the evidence is, you know, of not great quality or not great certainty. And that's important, I think, for a couple of reasons. One is it is just honest. So, you know, we're not making claims that, you know, we can't really support. But the other thing that's really important when communicating about evidence to the general public and everyone is that as more evidence comes, you may change your tune. So what we thought was true at one time, it was the best answer we could give, might change later because we learn more and we know more. And if you came out of the gate saying like, yep, this is the answer, it's kind of hard to walk that back later. So although you don't want people to say, you know, bunch of baloney, you don't know anything, you know, you still want to be respectful of the limits to our existing knowledge and say, you know, here's the best idea that we have right now. This is, you know, what we've based our policy on or our program on. And we're continuing to learn. Nobody loves that answer. You know, they'd rather have it be just like, this is the answer and, you know, it's going to be right and work for. It's not really the world that we're living in, though, particularly in public health domains. So, you know, finding that balance between being as confident as we can be and building public health confidence in evidence, but also, you know, not overstating the case. And that's where the quality appraisal really comes in, so that we can have an understanding of like, how good is this body of evidence, you know, to really base our decisions on. I don't know, Carlene, Sophie, Alyssa, do you want to comment on that in terms of, you know, how do we communicate this to the general public?
Yeah, I just want to comment on something you said, Susan, because I think it's very, very important. Like you said, the honesty aspect. There's sometimes mistrust with you know, the people making decisions or the government, and I think that kind of leads to potential other hindrances. So I think it's, like you said, it's important to, you know, be honest and understand that sometimes the reality is like decision makers are also trying to figure it out, and the evidence isn't always necessarily right there immediately to back it up, but that the goal is to help the general public as much as possible.
Mm-hmm.
Yeah, I would say from my experience, that's probably one of the biggest challenges within public health right now. Something that's been very clearly illustrated through the pandemic, and it kind of addresses also the last comment in the chat as well, the most significant barrier, which is it's really hard when you're dealing with evidence that is has some level of uncertainty. And I think for the most part, the process of science is that you are never 100% certain, or very rarely are you 100% certain. We're dealing with evidence and statistics and hypotheses, but we're never saying like this is 100% factual, never going to change. And I think dealing with that uncertainty or communicating that uncertainty, there's a very fine balance that I don't think public health necessarily has found its equilibrium for yet. And we've seen that with COVID, where when we try to we as in public health have communicated messages with uncertainty, and as Susan said, then may need to go back and adjust those messages. There's a lot of backlash because it appears as if there is some level of a lack of transparency or a lack of honesty, when the reality is that the situation is changing. And one thing, you know, when you are doing, I don't know if I'd call it ethical research, whereas you're not just making a claim to make something sound powerful and convincing. So when we're doing our reviews, we may say, you know, the studies indicated that the intervention is successful, but these studies were of low certainty. So we can't say for sure that this intervention is effective. And that it's not always super convincing or satisfying to hear something like that. So it's hard sometimes to compete with other qualities or sources of evidence that make really strong claims. That the reason that they are able or choose to make those really strong claims is because they're not perhaps weighing the certainty of evidence in the same way that an organization like the NCCMT is. So I think that's really difficult. And a barrier is how to share that information with the public in a way that doesn't erode trust. And I think that's a really big topic within the public health sphere in general.
Yeah, thanks for those comments. And I think that really does speak to the last question that we'll take up today, which is about the most significant barrier preventing further use of evidence-informed decision-making that we've seen. It gets pretty quickly into some complex territory. There are relatively few really clear answers that we can give. And so, people may sort of lose confidence overall in evidence, as well as one of the things that we've seen is people want to do their own research, right? Which usually is like looking stuff up on Google. And it's great that people want to sort of, delve in and, build their understanding of a particular phenomenon. COVID is one example, but, there are lots of others. And as we've been talking about with these methods and tools, there are skills that can help you be more confident and competent at actually unpacking research evidence and seeing, what evidence would I really want to be basing my decisions on, and what evidence should I not really put a lot of trust in. And those are skills that people can learn. It's one of the reasons that we have the NCCMT methods and tools, to help people do that. But it's a work in progress, I would say. People don't always have all of those skills really available to them. And some sources of evidence kind of take advantage of that and present research of sort of dubious quality, which doesn't really help us to build people's confidence in finding and using evidence. So just to wrap up, I just want to mention that if you are interested in other methods and tools, so we've talked about several today, but there are lots of them, some developed by NCCMT and others developed by others who work in the evidence domain. Check out the Registry of Methods and Tools, which is listed under knowledge repositories on our website. And there you will see resources to help you with different aspects of evidence-informed decision-making. There's a description of what the method or tool is, the link of where to get it. And if you're thinking, oh, I wonder if someone ever made a tool that would help me with this, you know, a checklist or something like that, that you're trying to do as you navigate through evidence, there probably is one. So check out the Registry of Methods and Tools, and hopefully you'll find some things that are just going to make your life easier. You know, if someone's already figured out a process for doing something, you might as well take a good look at what they have to offer. And the other thing that we just wanted to invite you to is to share with us, come on and be part of the NCCMT community. So if you are using evidence in a certain way, or, you know, trying a new method or tool, we want to hear about it. So you can email us at nccmt at mcmaster.ca. If someone will read your email, I promise you that. And if you have a question, we will get back to you about that. So we're happy to tell you, you know, if you're thinking, well, is there a tool? I looked on the registry, I didn't really see one, or, you know, help me pick between these ones. Happy to help you with that as well. So really do want to encourage you to reach out, to make NCCMT part of your community and part of your approach to using evidence in your studies and in your practice going forward. So thanks for being here today. Would love to get your feedback on this webinar. So we've got a couple of questions for you coming up as a poll. So if you wouldn't mind just taking a few moments to check through those 3 questions, give us some feedback. Also happy to hear your feedback sent to us by email at that address, nccmt@mcmaster.ca. Really always happy to hear from you. I hope this has been helpful for you, and we really want to thank our panelists and presenters today, Carleen, Sophie, and Alyssa. Really great to hear from you, and to hear from your perspectives how these tools and how evidence-informed decision-making may be helpful. So thanks to everyone who attended and who participated. Really appreciate having your interest in evidence-informed decision-making, and we look forward to connecting with you again. You'll see our, once the polling questions are done, and I think we're moving through that well, we do have our list of webinars, upcoming webinars, where sometimes we focus on a new method or a tool and talk about how people are using that in their practice. So happy to have your registrations at those upcoming webinars that may be of interest. And have a wonderful afternoon. Please be in touch with any further questions. And thanks again to Alyssa, Sophie, and Carleen. Take care, everybody.
Thank you.
Thanks.